Picture this. You're slammed on a busy night shift in the ER, and the paramedics wheel in a critical patient. The clock's literally ticking, stakes are sky high, and the clues to saving their life? Well, they're hidden deep within their blood chemistry. So how do you decode this mystery before it's too late? Today, we're going to unlock one of the absolute most high-yield cornerstones of medical education for nephrology and toxicology to help you do exactly that. Let's jump right into the case. We've got a 22-year-old male who presents to the ER with tachypnea, confusion, small respirations, and he's complaining of blurry vision. The kicker? His buddies mention he was knocking back some sort of homemade moonshine. Now, what's really fascinating here is that combo. Deep, rapid breathing, those classic small respirations, paired right up with the blurry vision. So what's the diagnosis? Well, before we can actually solve this, we need our trusty diagnostic decoder ring.
Salam, welcome to A Little Push, 5 Minutes Medical Mnemonics. I am so excited to guide you through today's explainer. We are going to totally master a mental framework that'll instantly help you solve complex acid-base mysteries, just like the one we're looking at right now.
All right, let's dive into the foundation here. The absolute most crucial thing to remember is that whenever you're faced with a metabolic acidosis, step one is always calculating the anion gap. The formula is pretty straightforward. Your anion gap equals sodium minus the sum of chloride and bicarbonate. Now, a normal gap sits right between 8 and 12 milliequivalents per liter. But what if that gap shoots up greater than 12? Well, that elevated number is a massive red flag telling you that unmeasured, hidden acids have crashed the party in your patient's bloodstream. And to remember exactly what those primary culprits could be, we lean on our favorite high-yield mnemonic, MUDPILES. Let's break down MUDPILES letter by letter. Starting off strong, M is for methanol. You'll usually see this associated with someone ingesting antifreeze or maybe windshield wiper fluid. Once it's in the body, methanol breaks down into some seriously harmful metabolites. And here is your golden clinical pearl. It classically causes optic disc hyperemia and vision loss. Ding, ding, ding. Think back to our opening case, our 22-year-old who drank moonshine and had blurry vision. Yep, that was classic methanol toxicity staring us right in the face.
Okay, let's keep this momentum going. M-U-D. So U is for uremia, and D is for diabetic ketoacidosis, or DKA. Uremia is going to pop up in your patients with chronic renal failure. Because their kidneys just aren't filtering like they should, they can't excrete organic acids, which cranks up that anion gap. Next, we have DKA, which, as you know, is a state of severe insulin deficiency. It's characterized by the body just overproducing ketones. Specifically, we're talking acetoacetate and beta-hydroxybutyrate. These ketones, they're those sneaky, unmeasured acids stacking up in the blood.
Moving right along to P&I. P stands for propylene glycol, or paraldehyde. Now, paraldehyde is this older sedative you really don't see much of anymore. But propylene glycol? That is super common. It's used as a diluent for IV meds. Think high-dose diazepam or lorazepam. Hit a patient with a massive dose of those, and boom, they can develop an anion gap acidosis. Then we've got I, which is for iron or isonazid, commonly known as INH. Iron overdoses are just notoriously toxic. And INH, that classic TB drug, is a huge high-yield trigger for refractory status seizures, which, you guessed it, drives up acid production.
Next up is the L in MUDPILES, and that is lactic acidosis. You are going to see this one all the time in the clinic. Lactic acidosis is usually caused by tissue hyperperfusion. So if your patient is in shock, if they're battling severe sepsis, or even severe anemia, their tissues are just starving for oxygen. To cope, the cells switch gears, and the byproduct of that is lactic acid. It's a massive, blinking red flag that your patient's organs are seriously struggling.
And bringing it home, we reach the E and the S. E is for ethylene glycol, which is another incredibly dangerous substance found in antifreeze. Now listen up, because here is your classic board exam clue. Its metabolites cause the formation of calcium oxalate crystals in the urine. If you look under a microscope, these crystals literally look like little envelopes, and they can send a patient right into rapid renal failure. Finally, S is for salicylates, basically aspirin. An aspirin overdose is wild because it causes this fascinating mixed acid-base disturbance. You get a primary respiratory alkalosis, because they're hyperventilating, paired right alongside a primary metabolic acidosis, the whole shebang. All right, let's take our detective work a step further. We've already calculated our increased anion gap, but
If you suspect one of those toxic alcohols is at play, you absolutely have to look for the osmolau gap clue. If your patient has an increased anion gap plus an unexplained osmolau gap, which is basically just the difference between their measured and calculated osmolality, you need to strongly suspect a life-threatening ingestion of methanol or ethylene glycol. It's an absolutely brilliant biochemical clue.
So, here's the million-dollar question. Once you've cracked the case, how do you treat it? Now, management is obviously directed at the specific cause, but for those incredibly deadly toxic alcohols, we've got a very targeted weapon. The key to treatment here is fameprazole. Fameprazole is your preferred specific antidote because it literally inhibits the exact enzyme that converts methanol and ethylene glycol into their toxic, tissue-destroying metabolites. You block that step, and you stop the toxins dead in their tracks. All right, time to test your focus with a quick rapid review quiz. Let's see if that high-yield clinical pearl stuck with you. Here is the question. Which MUDPILES ingestion classically causes the formation of envelope-shaped calcium oxalate crystals in the urine? I'll give you a few seconds to lock in your answer. Think about it.
And the answer is ethylene glycol. If you remembered the antifreeze and those sneaky little envelope-shaped crystals leading to renal failure, you absolutely nailed it. Seriously, cement this clinical pearl into your brain right now, because I guarantee it is going to show up on your boards and out there on the hospital wards.
You've just mastered a critical differential diagnosis tool that is going to serve you throughout your entire medical career. But remember, MUDPILES is really just one piece of the puzzle. What other hidden toxicological mysteries are lurking in your patient's routine blood panels, just waiting to be decoded? Keep pushing your clinical knowledge forward. Until next time, salam.